As a chronic fatigue syndrome patient, I understand how hard it is to accept that I'm ill. My friends and family have the same trouble believing until they witness the confusion and irritability that develops when I multitask too much. Imagine you are innocently showing me photos of a recent trip. Flipping through those screens can quickly overload my system. Brain fog rolls in, and now I start getting confused. On the defensive, I raise my voice and tell you stop. I want all of you to see chronic fatigue syndrome as it emerges, because then there wouldn't be any doubt in your mind. Just like the enlarged heart on the X-ray, the abnormal cell on the blood smear, you would see it and be convinced, curious to know more. But because invisible illness is, well, invisible, and patient reporting isn't captured using repeatable data points, it's hard to recognize symptoms like mine until you see it. Your instinct and training will tell you to react. But what if instead you decided to wait and observe? I first learned the value of the wait to treat philosophy from some tulips in the backyard of my childhood home. Magical tulips, really, because by a rough estimate, they have been coming up for nearly 70 years without fail, even though the average tulip has a life expectancy of 2 to 5 years. Each year, these tulips come up, sometimes with just leaves, other times with multiple blooms. And for nearly 3/4 of a century, we have simply left them alone. No fertilizer, no extra watering, nothing. Watching them taught my family to understand the non-blooming years as being restorative, not a time for intervention. What would it look like if you didn't introduce any variables to your CFS patient's care and just watched? Hard, I know. As practitioners, we want to help. And it's so rewarding to diagnose the problem, develop a treatment plan, and send the patient out the door. I know what I'm suggesting is different from the diagnose and treat message we were taught during our training as medical practitioners. But when I went to see a chronic fatigue specialist, my CD57 count was low. So I underwent a 7-month course of alternating antibiotics. My CD57 never changed. So feeling mentally and physically exhausted, I stopped. My physician made sure I understood that without further treatment, I would get worse. 2 years later, my CD57 was still low, and yet I hadn't gotten worse. They didn't see value in observing me, but observation is exactly what I needed. Perhaps, like the tulips in my yard, your patients need it too.